Hey everyone! We're coming to you from the Roar Room at Penn State, and we are here today to talk to you about pathways to healthcare at Penn State. I'm Sneha, and I'm from the North Texas area, and my major is applied data science at the College of IST.
I'm Haley. I'm a senior kinesiology major within the College of Health and Human Development, and I'm from Johnstown, Pennsylvania.
I'm Elizabeth. I'm from Harrisburg, Pennsylvania. I'm a senior majoring in veterinary biomedical sciences in the College of Agricultural Sciences.
So first, I wanted to ask, how has Penn State set you up to achieve your career goals?
Yeah, I can go first. So for me, Penn State has set me up, I think, in two ways to achieve my goals. Number one, academically, since I am going to graduate school, I felt as if I was going to need kind of a rigorous academic course load and classes all together, just because I know that in graduate school, the classes are going to be much more intense and kind of faster paced than in undergrad. And I think that HHD and Penn State as a whole has just done such an amazing job at preparing me. I think that the classes in HHD are really set up for you to learn the information long term, not just for you to learn it quickly for an exam and kind of forgetting it, as we all know that can happen. And yeah, I'm really excited to get started in grad school. A lot of my peers are really nervous for our anatomy course that we're going to be taking in the fall. While I'm nervous to take graduate coursework, I am pretty confident in my anatomy skills because of Penn State courses like Kines 202 and Bio 161 that I think have done a great job at providing me with a really good foundation. And then the other side of that is all of the extracurricular things I've been involved in. That's what has gotten me into my graduate schools. I could have gotten a bachelor's of science in kinesiology at plenty of places with probably the same GPA about that I have here, but it's things like kinesiology, street medicine, and being a part of HHD ambassadors, which we'll talk about later. And I really think that's what kind of set me apart on those applications and is allowing me to be admitted into graduate school.
That's awesome. Was it always something that you wanted to do?
Go to graduate school?
Yeah.
When I first started at Penn State, I thought maybe I wanted to go to med school, and that's kind of why I chose kinesiology, because it seemed like a good route into that. I quickly learned I'm not interested in med school, but it wasn't very long that I was kind of looking for an alternate path, because pretty immediately I had a professor in a kines introductory course kind of take a break from his biomechanics lecture and go over some lesser known fields within kines, because of the fact that a lot of first year students come in thinking they want to do PT, and a lot of professors like to do what they call taking off the PT blinders and just kind of opening up students' realm of possibilities. And that's totally what happened for me. He talked about orthotics and prosthetics, and even just his little PowerPoint slide was enough for me to do my own research and eventually become super invested in the field.
That's awesome.
Yeah.
Awesome.
What about you?
Yeah, I guess in a similar way to me, they kind of set me up in a few different ways. The main way was definitely academically. I feel like here at Penn State, especially I want to go into the vet school realm of things. I feel like academically it really set me up with the amount of courses we're taking per semester. So we average 15 credits a semester, which is, kind of course heavy with a bunch of deep sciences, making sure we're getting all of the background information we need in order to take higher level courses and take in-depth vet med courses, which I feel like they really set up here in the College of Ag. And another thing I think is great about the College of Ag is that we're kind of a smaller college, so we're able to have more one-on-one interaction with all of the professors. So in all of my higher level VBSC courses that I'm taking, it's probably 30 of us in the class, and I'm able to get a lot more hands-on experience and learn from them. And also definitely the clubs have prepared me as well, but we can also get into that later.
That's awesome. Yeah, I feel like being from Texas, a lot of times people will ask me why did you choose Penn State? And I always knew I wanted to do data science when I was in high school, but I wasn't sure exactly where I wanted to go in the career industry. So I think something really great about Penn State in the College of IST is that you can kind of select what you want to do in your junior and senior years. So the way that Penn State has really supported me is giving me specific courses to take in my freshman and sophomore years, and then I've kind of gotten some wiggle room to choose the courses I wanted to do. So that's also helped me explore industries. I had an internship at the hospital this past summer, and then I also am going to get to do a banking analyst internship. So that's definitely helped me.
Awesome.
Yeah. Um, are there any clubs or organizations that have kind of helped you prepare for that kind of career?
Yeah, absolutely. So, something that definitely comes to mind when we talk about kind of clubs that have deepened my understanding of healthcare is not necessarily a club, more of a class, but the kind of community that we've built in it and the way that all of the people who have taken the class kind of know each other. Has a lot in common with a club, but it's actually Kines 414. You don't have to be a Kines major to take it though. It's interdisciplinary study of street medicine, and it is a full semester course where we meet once a week and we learn about homelessness and like the social barriers, the economic causes, the environmental factors, why it's so bad in some cities in the U.S., particularly Los Angeles. We also did a couple different initiatives in town throughout the semester. For example, we went to a transitional housing facility that's downtown on Pew Street, where we kind of had a picnic with some of the residents, and we brought like homemade rigatoni and like a veggie tray that we had donated, and kind of just talked to the residents and like hung out with some of the children that were there at the time, and just kind of heard about their experience with transitional housing and having experience being homeless. We also were throughout the semester doing our own personal fundraising initiatives. For example, I reached out to a feminine hygiene brand called Lola and was able to secure a major shipment of feminine hygiene products that we were able to use in our initiatives, which was super cool. A classmate of mine had a similar experience with Bomba socks, where she was able to get us 500 pairs of socks to take with us. And it was all in preparation for our big trip, which was to LA for a week. It was over October this year. And yeah, we had such an incredible time while we were out there. We literally were on the move the whole time, but we went to a couple different shelters and were able to meet with residents, meet with the program directors. We compared and contrast some of the techniques and the strategies that are used here in PA versus out in California, and just kind of the differences. And we toured a couple different shelters and everything as well, and transitional housing facilities, and we were able to give out. We had over $100,000 worth of donated clothing that we had amassed over the semester that we were able to give out at those different places, which was just an incredible feeling to be helping out. And we had a lot of like comfortable hoodies and sweatpants, and people were really excited to receive those, as well as some food that we got donated by local companies as well as national companies, even just as simply as walking up to like the manager at one of the grocery stores downtown and just asking can sometimes get you really far. But the main thing we were doing was hanging out with the University of Southern California street medicine team. They have like a fully developed team that is founded by 2 Penn State graduates, and all of their patients, their doctors, nurses, physician assistants, whatever it may be, and all of their patients are homeless individuals on the streets of LA. And we went with them and got to kind of watch their process, kind of learn about how they do such an incredible job every day and like what gets them through it, and just meeting the patients, hearing their stories. It was just incredible, and such a nuanced realm of healthcare that none of us really knew about before taking the class. A lot of us like are now interested in maybe working with that population someday. We never would have learned that beforehand. And we all just learned so much about compassion and just strategies to really help patients on such a deep level, and even like breaking some of the barriers of American healthcare, like insurance issues, and just really showing how far your care for a patient can take you. So that's definitely something that's taught me a lot about healthcare here at Penn State.
You've also said that that was something that you didn't really like know about until you took the class.
Mhm.
Was there like some interest in anything related to that like before college at all, or was this kind of your first like foot in the
Yeah,
door for
that was
everything?
totally like my first experience, even really knowing that street medicine was a thing,
Mhm.
was when I heard about that class, because it's not really something that you think about, especially like growing up in Western Pennsylvania, where homelessness isn't as much of a thing as it is out in California. So you're not really seeing what's going on. But actually, something really cool about the people who founded the program out at USC is street medicine didn't used to be as big of a thing because it wasn't possible to bill insurance if the patient didn't have an address. And they actually, and I don't know like the specific details or any of the laws because that's just not my field, but they worked with lawmakers and advocacy and just like really being very like proactive and really going out and trying their absolute hardest to get done what they needed done. They were able to get some laws changed and some things kind of put in place. So now that they are able to bill insurance for the services they provide on the streets.
Awesome.
That's awesome.
Yeah. So it's definitely becoming more of a thing.
Yeah, that's great.
Yeah.
What about you?
Yeah, I feel like Penn State kind of like sets apart from other colleges based like just because of their organizations and clubs they have here. I've been pretty involved here at my time. The main clubs I'm involved with is Pre-Vet Club, which is a club that we meet bi-weekly. We usually bring different types of veterinarians in all the different fields that you can do to come speak to our members and talk about how they got to where they are, what they did in undergrad, and how they were able to reach their success they're at right now. And we have hands-on labs, so like people can get experience actually working with animals and like doing something that they might do in the vet med field. And as well as the One Health Club, which is like the intersection of animal, human, and environmental health, which is kind of similar to what you were talking about in your class, which I have really enjoyed my time there and being able to kind of get a new set of experience and like understanding of healthcare altogether that I wouldn't have gotten if I hadn't been in the club and so heavily involved with it, because I was kind of stuck on like the animal side of the field, and I started to learn more about like human healthcare and environmental health, which I like wouldn't have learned about at all if it wasn't for the club. And then I am a part of an organization here on campus where we can raise service dogs, which has been a really cool experience and something that I've truly enjoyed, being able to see the difference you make by, spending 18 months of your life raising a service dog for someone else. And it's been really rewarding and exciting to learn more about, I guess.
How did you learn about the program to raise the service dogs?
Yeah, so it's on campus. It's called Roar for More. I don't know if it's necessarily a club on campus, but there's a lot of students that do it. It's through Susquehanna Service Dogs. So you kind of get the puppy at like 8 weeks old, and they kind of teach you how to teach the dog certain skills that they'll need throughout their career, which has been really cool.
I've never heard of that. That sounds so cool.
Yeah, I'm actually on my second dog. So the first dog I raised made it all the way through and unfortunately ended up getting discharged. But I'm raising my second dog now, and she's almost 10 months old, which is a lot of fun.
So do you get to like take the dog home and like completely raise?
Yeah, so she lives with me off campus, but some people do live on campus raising the service dogs. We go to a bi-weekly meeting to, like I was saying, to train the dog and kind of work in a different environment with other dogs in the environment. A lot of people take their dogs to classes, and you kind of get more experience going on outings with them and teaching them kind of how to be calm in public, and like not everything is so scary, because a lot of dogs have that fear.
Do you feel like that's like helped you kind of finalize your decision in doing vet as well?
I feel like definitely I've learned a lot about dog behavior that like you kind of need to understand in order to work in the vet med field. You're learning about animal behavior, and you're working in such close quarters and doing things to animals that might make them feel uncomfortable, that you can kind of see warning signs that the dog or animal might have before they're going to bite you or something like that. So it's definitely taught me a lot about how to look at an animal and kind of figure out what behaviors they're showing and before anything crazy happens.
That's cool. That's awesome.
That's awesome.
Yeah, I guess for clubs that I'm in, I'm currently the director of IST Diplomats. It's a club where there's student ambassadors, and we kind of help students get adjusted to the college and give prospective students tours and talk to families as well. And then another club that I'm also involved in, or organization, I guess, is just undergraduate research. So this is more kind of in the tech field and not necessarily healthcare, but I think it's definitely opened my eyes to how you can pick a specific topic and kind of see like the entire pipeline from beginning to end. And this really helped me when I was in my internship as well at the hospital, because working with a lot of sensitive information that's confidential as well regarding patient data, and to like see the end results of that and how it can actually contribute to like real world problems was really important. So yeah.
Awesome.
Yeah, I feel like there's so many important lessons to be learned from research that are so much bigger than like the project itself.
Yeah,
Mhm.
definitely. And I think another thing too was working with a lot of grad students and learning from them when I had no idea what was going on. I
Hmm.
was like, what even is research? But yeah, that definitely helped me when I was also like at my internship because I also didn't know what was really going on. I
Mhm.
didn't know the operation system of how a hospital worked as well. Which kind of brings me to my next question is what are your internship experiences?
Yeah, so my internship experiences have been super cool while at Penn State. So in kinesiology, it's one of the majors here on campus that you have required internship hours. So there's three different kines courses that you move through. Typically, you'll take the first one your sophomore year, then your junior year, and then your senior year, or maybe the summer before after your senior year. And they move up in hour requirement and also depth. So the first one is a 12-hour requirement, kind of just a shadowing experience. And for mine, I actually was at a physical therapy clinic where I learned that I didn't want to be a physical therapist,
Mhm.
which is definitely just as valuable, I think, as learning that you do want to do something. And then for my 395 kines class, which is a 45-hour requirement, which those hours have been adjusted over the last couple of years. So I know that this upcoming semester they're going to be a little bit different, but it's going to be around 40 hours, I believe. But I did mine at an orthotics and prosthetics clinic in my hometown because it was kind of just as I was discovering the field and got an interest in it. And I loved it so much. Like the first day I was there, I think I didn't stop smiling the entire time. And even though it was just like a quick 40 hours, it really developed my love for it enough that that's what I went back to do my capstone kines internship for at the same clinic. And that was for my year, it was a 270-hour requirement, but I loved it so much and I needed the hours for grad school. So I was actually there for over 500 hours. I was pretty much full time over the summer. And it was just an absolutely incredible experience. I learned like how much I love orthotics and prosthetics, and I learned so much about the technology and how to create devices and prosthetics and like the technology of the field. But I also learned what kind of CPO or certified prosthetist orthotist I want to become. Kind of having the CPO at my clinic as a role model, just learning so much about empathy and leadership from him and from everyone that worked there. And I just was able to do so many projects independently, like fabricating orthotic devices like AFOs and different braces, and same thing with like prosthetic sockets. I'll never forget this one patient that I had over the summer. I kind of met him pretty quickly after his amputation surgery and was able to kind of follow along on his journey throughout the summer and created pretty much independently his prosthetic that he was given. And by the end of the summer, he was walking in and out of our clinic on it super independently, like with almost no issues. And it was just like one of the main moments that solidified my love for the field and really just made the decision so easy for me as to where I wanted to go in the future. And yeah, I had so much fun there and learned so much, and I miss them all the time.
That's amazing.
That's
Yeah.
awesome. Yeah. What about you?
I guess I could talk about my internship
Yeah.
experience. So the main internship I had through kind of Penn State is a Penn State alumni opened up his practice about 15 minutes away from here called Metzger's Animal Hospital. And as I was able to get an internship there, it was 6 weeks long. I think it was about 300 hours or something like that. We basically did 2-week rotations throughout the hospital, kind of getting a feel of what it would be like to be in vet school and doing their kind of clinical rotations. And I was able to learn a lot more about the field and kind of understanding what it is that veterinarians do, because you kind of have a background knowledge. Obviously, you know what they do, but like actually seeing it happen, like working in the emergency hospital and being able to see how quickly they're able to react and kind of work together as a hospital with all the techs, the assistants, the receptionists, and kind of getting a feel of how the hospital operates was really awesome. And at the end of the internship, we kind of curated a case study on a patient we saw there and like what they went through and kind of understanding the disease process that happened. I ended up doing mine on primary hyperparathyroidism, which I had no clue what that was until I started learning more about the case and the dog and everything that happened. And at the end of the internship, we were able to present our case study to the hospital staff and then to some Penn State staff, which was a really cool learning experience because I had not ever presented something in front of a bunch of professionals and veterinarians who all know what I'm talking about and would know if I'm saying something silly. But it was really cool learning experience, and I've definitely learned a lot about the vet med world and everything that happens in a hospital for sure.
That's awesome. Did either of you have like an idea of what you kind of wanted to do as an internship, and how did that kind of change? I know you said you didn't really enjoy your first one, and it kind of narrowed down your experience more too.
Yeah, for sure. It definitely is really a good thing. I think that with kinesiology, you have those required internships because it definitely like kind of pushed me out of my shell, and I'm very grateful for that because I honestly don't know if like I would have ended up putting my foot in the door of an O&P clinic unless I had to because of kines. And with that, you get a lot of support from professors who teach those 300 or those 295, 395, and 495 classes that I mentioned. They won't hand you the internship or like call anyone for you, but they will absolutely help you with your resume and help you with like your cover letter and walk through like a practice phone call with you or anything that you might need just to build the confidence to reach out. So that absolutely helped me, as well as just going through the process with those professors, letting them know and doing the assignments about how did your first internship go. And they totally are there to help you like re-navigate and kind of find your path to your next one, which was super helpful.
Awesome. Yeah, what about you? Did your career interest kind of change at all?
I kind of always knew that I wanted to be a veterinarian in the future. I wasn't sure exactly what kind of animals I wanted to work with. I have an idea that I want to work with small animals, but I know a lot of people always go into vet school saying that and end up working in large animal or production animal. But I, at the moment, want to work with small animals, and I got a second internship working at a hospital in my local area, which was like a normal clinic. It wasn't an emergency hospital, so it was kind of like seeing patients constantly and kind of getting to meet the patients, know the patients a lot better. And it was also a very cool experience to kind of learn more about all of the different ways that vet med is connected and how it's all very different from each other, but all similar.
Yeah, no, that's awesome. I also did an internship at a hospital this last summer, and there were kind of two projects. One of them was a little less technical, where I was looking at past hospital data, and then kind of just seeing what are problem spots of the specific community of State College. And then the other one was a little bit more technical, which I'll talk about a little later. But I remember getting there and just not knowing like anything about what a hospital was or how I could interpret medical data at all. So I spent like that first week just reading a bunch of health reports. And then once I kind of got my understanding of what I needed to do, I was able to find data sets that were publicly available or internal within the hospital and create a report about specific problem spots that the community needs, which is specifically with transportation, because we found that the older community is kind of struggling with being able to have access to healthcare in a fast way, which is something that was really important. I think that also it opened my eyes into knowing that I wanted to do more of like an analytics kind of role with my internship and career field in the future. And so the second project was gaining a lot of internal hospital data and also this big data set of information from the entirety of the state of Pennsylvania. And then I was able to create specific visualizations, seeing trends that maybe we need more rooms in a specific hospital unit, or maybe we need more transportation, like I said before. So that was really interesting because I was also able to give a report, which I was initially really nervous to do, but it was in front of the entire department that I got to work with, which was the organizational team, and they were able to use that information into the upcoming Community Health Needs Assessment for 2028. And I think it's really great that I was able to impact the community. I think you talked a little bit about the community earlier as well. And my dad always says this really cheesy line that the community we build is the community we live in, but I think that's definitely so true. And even as I explore other industries, I think knowing that I can make an impact on my community. I think that's something that's so important in healthcare in general. So finding that niche and leading with empathy as well, like you also said, is really important to me. So something that I'm really proud to say is that I'm part of an organization called IC Diplomats, which I kind of mentioned before. But it's an ambassador program where students are trained to give tours, give speeches, sit on panels. And so I was involved in this since I was a freshman, and they really try to introduce you to a lot of faculty and students who are also interested in specific majors that you are. And another opportunity also that I got from IC Diplomats is being able to go to a conference called the Tapia Conference in San Diego my sophomore year, where I was able to connect with recruiters and sit in on panels and understand from industry experts kind of what is happening in the world from a more diverse tech experience as well. And this also gave me more practice to give like my pitch and talk to industry experts before talking to industry experts at the career fair at Penn State. So I'm really thankful to Penn State to allow me to have that opportunity and also to the club that I was in.
That's awesome.
So are there any leadership opportunities that either of you had that you're really proud of that helped you kind of transition into the healthcare industry too?
So Sneha had to get going, but to pick up where we left off before she did, she asked us about leadership experience that we've had at Penn State. For me personally, this is one of the most special things that Penn State has given me. I feel like I have become such a leader that I never thought I would back when I was in high school. So one of the things that I've gotten involved in is HHG ambassadors, which is kind of like the ISC ambassadors that Sneha was talking about earlier, but a little bit differently because we talk only to prospective students. It kind of goes to a different department once they enroll, but we host accepted student days. We kind of run the big meetings for those and as well as the department meetings. But as far as leadership, I've actually been able to serve as the vice president of this organization for the last year and a half-ish. And I've gotten so much experience with public speaking, talking to the students and families, and as well as leading the rest of the ambassadors. It's been so incredible. I never thought I would be able to talk in front of crowds of 200 to 300 back in the day, but now I do it with ease almost every week, as well as my group of about 70, 60 ambassadors that we have now. Another leadership opportunity that I'm so lucky to have is HHD has something called a peer assistant. So in our first year seminar course that every first year HHD student has to take, it's taught by a faculty member as well as a student who kind of co-teaches it. And that's what being a peer assistant is. So I had about 30 students last semester who were in their first ever semester at Penn State, and we kind of teach them about study skills. We teach them about resources on campus, whether it's financial resources, like advising, tutoring centers like Penn State Learning. We even do things as simple as what to do when you run out of meal plan and it's only week 12. Just as many like valuable college student skills as we can get through in a semester is really what we aim to do. We also really try to create bonds between them. And it is a paid position too, which has been really awesome to support me in like my tuition and everything. But yeah, I never would have known that I was interested in any kind of like higher education experience, but now that's definitely something that I have in the back of my mind moving forward. I actually just saw one of my students the other day, and she told me that her and another girl from the class are living together next year, which was just really sweet to hear. And it really made me feel like I had a positive impact on their first couple months here at Penn State, which I'm really grateful for. And then another leadership opportunity that I've had here, I guess I'll just touch on this quick, is through Thon. So if you haven't heard of Thon before, it's the largest student-run philanthropy in the world. And our mission is to provide emotional support, financial resources, and funding for critical research, all in pursuit of a cure of childhood cancer. And I was able to be a captain this past year for Thon of the development committee. So I had, again, about 30 committee members who I got to kind of prepare for Thon and teach them about a whole bunch of different aspects of Thon and just let them know over the months what their role would be. We met once a week. And then I met once a week as well with my captain committee. and it was really an honor to be able to not only have an impact on the Thon community, but really to inspire my committee members. That's kind of when I applied to be a captain this year, I knew I really wanted to have a committee, and now I have a few of them reaching out, like telling me they want to be captains in the future. And that's really the whole mission of having a committee, is just really trying to further the mission of Thon as the years go by, and
Mhm.
just kind of leave an impact that lasts longer than your time at Penn State. And I'll never forget my experience as a Thon captain. It's definitely one of the best things I've done at Penn State.
That's awesome. Yeah, so I kind of have a similar experience with I'm also in a student ambassador role with the Ag Advocates in the College of
Hmm.
Ag. I certainly never saw my freshman year self ever being able to speak in front of a crowd, let alone like 100 people. But now I am also able to talk to prospective students, admitted students, and kind of guide them in their journey and talk to them about how I got to where I am and, other ways they could get to where other people in the college are at, which was a very cool experience. And I joined that last year, and I didn't really know it existed until last year, but it has been a great learning opportunity and leadership opportunity. Another leadership opportunity I've had is I'm the president of Pre-Vet Club, and so our club is roughly 200 students. So being able to kind of, work with my officer board and kind of make sure everything's running smoothly has been a incredible learning experience, and being able to work with that many people has been something that I've been very excited to be able to do this year. And I'm unfortunately sad to be able to giving it up right now because we're graduating soon. But through the Pre-Vet Club, I was also able to dance in Thon, which I know we were kind of talking about earlier. But it was an incredible experience that I honestly, like, one of the best experiences of my life. I had so much fun being able to dance in Thon and learn more about what Thon is and the entire mission during the Thon weekend, which was fabulous. Um, and another leadership opportunity I've had is I'm the vice president of the One Health Club. So I kind of plan all of the meetings and all the speakers that are coming to come talk to the club, which has been an incredible learning experience as well because, I have to reach out to a bunch of people and kind of figure out schedule and making sure everyone is still able to come, kind of trying to figure out and making sure I'm not being biased in the club because it's not really just about vet med. And it's also about human medicine and environmental medicine. It's kind of hard for me to branch out and make sure I'm not only talking about vet med, which has been an incredible experience to be able to. I've learned so much more about like human medicine, and I was able to work with the Lion Mobile Clinic, which I had never thought was possible being a pre-vet major, but it has been a great experience to learn more about what One Health is and kind of working in another exec board. Um, yeah, and I think that's the most of my leadership experience here at Penn State.
Yeah, that's awesome. I could probably speak for both of us when I say we don't have much free time.
Yeah, there's a lot.
Yeah, but I think that like being a leader at Penn State and just kind of working with peers in that way just teaches us so many like valuable lessons that you're not going to get otherwise. So, yeah.
Yeah, I've certainly learned a lot about problem workshopping and being able to work through things with advisors and things like that.
Yeah, for sure. So, as we wrap up here, and we're going to be wrapping our 4 years up here soon, we can talk about kind of our last piece of parting advice for any incoming students. Um, so, mine would be something that my aunt actually said to me when I was a senior in high school getting ready to come to Penn State, which was that everyone around you in your classes and your dorms are in the same shoes as you. And to remember that when it comes to reaching out to other students, to going up to professors, to talking to your RA. If you're feeling nervous, if you're feeling excited, if you're feeling scared, there's a very high chance that other people in your class or your dorm are feeling the exact same way. And that really helped me when I was starting out to not be shy and just remembering that you're not alone when you're here. You're with so many other incoming students that have the same feelings and nerves that you do. And yeah, that's probably my standout piece of advice when it comes to starting at Penn State.
Awesome. Yeah, mine is kind of on the similar wavelength as you. My advisor actually told me this when I first came to Penn State, is to join clubs at Penn State. I know that it's a very obvious thing to say, but being able to get involved in a club my freshman year and stick with that club is where I met all of my best friends. I was like painfully shy my freshman year, and it was really hard for me to put myself out there, especially in classes when I was just like head down focusing on my notes and kind of only the same friends I had in high school I was talking to. And it was a struggle for me to branch out, but I was able to join the pre-vet club my freshman year, and I wasn't really talking to anyone freshman year because I didn't really know anyone. But sticking with it, I met all of my best friends in that club, and I was able to grow and join more clubs after I found my specific niche of things that I like to do, which was an incredible experience. So definitely put yourself out there. It's okay. I did it. You can do it. It's okay to be shy. And it'll all work out from there.
Thank you to my fellow guests, Haley and Elizabeth, for coming today and having a great conversation. And we're going to sign off with a we are. So we are.
Penn State.